if you're wondering if there is one exercise that activates and strengthens every part of your body, just the one exercise that involves every single part of your body in strengthening, I've got an answer for you. Hey, I'm Dr. Shaki from Irvine Spine and Wellness Center, your Irvine Chiropractic and Posture Clinic. Watch this. Okay, so this exercise is actually what we all did at age 10 months. In developmental kinesiology, dynamic neuromuscular stabilization specifically, which is what we do at the office, this is what a 10-month-old baby does. There's a prelude to it, and then after this pose, there's other things that we do. I don't want to make that about DNS, but the way you're going to do it is actually, to some degree, it's a yoga pose too, if it's done right, which that's a big if. Not that yoga's not teaching it, but people do funky stuff doing yoga. So what you want to do is you want to sit on your seat bone. Seat bone is literally your seat bone. If you touch your butt, there is a bone sticking out on both sides. That's your seat bone. So you're going to be sitting right on it, not behind it, not in front of it, not tilted forward or backward with the curvature here. So you're sitting upright on that, engaging your pelvic diaphragm, which we're going to put a video at the end of this if you don't know what that means. And the way you're going to sit, I'm going to swing forward for now and then go back to the side view. Your feet are lining up with your knees, lining up with the middle of your groin, just like that. And you're not letting your knees fall out or in. So what's happening is if it's out, you don't want to bring the knee in. You want to activate it from the inside, pulling it in and keeping it in place. It's a much longer arm. If you activate it from up here, you're going to sustain the position for much longer. So you're going to be just like that, sitting on your seat bone, engaging your pelvic diaphragm. You're not slouched forward. It's as if a string is attached to your head and bringing your spine up. You're not hyperextending and sticking your chest out either. You hold it there. Your top of your shoulders drop. You hold your arms here, just like that, and you lean. Your head's not gonna be forward. So if this is a challenge for you, just hold that pose until it's no longer a challenge. And then you hip hinge back. Hip hinging back is not going that way and arching your back. And that's a big one for you to pay attention to. Keep everything as if it's fused from here up to the back of my head, all fused. Keep the knees midline, not too far in, just tracking your ankle and your hips. Keep yourself upright, go there and hold it there. Little by little, as you gain strength, you can bring your up like that and hold it without slouching. You can move your ankles up and down. Those are all different things you can do. That's of course not what you did at age 10 months. At age 10 months, you just learn to hold yourself this way with your ankle, with your feet up and bring it down. That's a great stretching of your calf muscles while you're holding everything else in place. So if movement is a concert, the spotlight in this exercise is really on the whole orchestra. Not one single part of you plays anything more than the rest. They're just holding on to their section and just performing outstandingly. A concert where all the musicians are playing their part beautifully. This is how you build strength at the very beginning, 10 months of age. Thank you for watching. Make sure you subscribe to my channel. Take care.